Kody Bolk. I'm one of the rhinology and endoscopic skull-based surgeons at SIU, part of the Department of Otolaryngology, and here to talk to you today a little bit about chronic sinusitis. So chronic sinusitis, or chronic rhinosinusitis, or CRS for short, is an inflammatory condition that lasts more than 12 weeks inside the nose and the sinuses, despite our attempts at medical treatment. Broadly, it comes in a couple types. One of them is chronic sinusitis without nasal polyps, which has no growth of these polyps inside the nose, or with nasal polyps. And these are little, smooth, non-cancerous, grape-like masses that grow inside of the nose due to the inflammation in that region. So when we make a diagnosis of chronic sinusitis, it starts by patient symptoms, but also our objective findings. So for symptoms that patients might have, these can include things like loss of sense of smell, facial pain or pressure, drainage both from the front of the nose or down the back of the throat, as well as trouble with congestion or breathing through the nose. And we have to have 2 or 4 of those symptoms that last for longer than 12 weeks, or about 3 months. We also look at some objective findings, and what I mean by that is we look inside the nose and also look at scans or CT scans of the sinuses. So when we look inside the nose, it's called nasal endoscopy. We use a small camera that fits easily into the nose to take a look around. And we can see where the sinuses drain, but not directly into them if you haven't had surgery. But it gives us an idea of the health of that region. We're looking for things like swelling or edema, we call it, things like secretions or pus, which can be a sign of infection, or polyps like we just talked about. Other things that we will do are a CT scan, like I had mentioned, which allows us to get a snapshot in time of the health of the sinuses. So we can get a glimpse inside and see if there's any signs of inflammation or thickening is what it looks like on a CT scan, which clue us into what might be going on. And according to our clinical practice guidelines, we need to have patients that have symptoms that are greater than 12 weeks or 3 months, as well as these objective findings in order to make a diagnosis of chronic sinusitis. There are a lot of causes of chronic sinusitis that all play a role. It's got multifactorial roots and what give us this disease. So it can be things like allergies or the environment. It can be things like pollutants or irritants in the air. We also see that patients' own individual anatomy inside their nose and sinuses can predispose them. Chronic infections can play a role, but also a patient's own genetics. For instance, if a patient has some sort of immune deficiency, that can lead to chronic sinusitis as well. And whenever we have these factors all come together, we can get inflammation inside the nose and the inability to clear out secretions, aerate the sinuses like they should, and that can lead to chronic sinusitis and its subsequent symptoms. Yeah, so the first step, like you said, is always medical treatment for chronic sinusitis. And this comes in a couple things that we do. There's some nuance based on the type of sinusitis that an individual may have. But for broad strokes, we can talk about a few of the things that we do. The first one is nasal sinus irrigations, or basically rinsing out the nose with salt water. So what you do is use distilled water or previously boiled water, pour it into one of those sinus rinses along with a salt packet, and literally irrigate out the nose. And this helps to rinse out mucus, other allergens, things that can lead to us having inflammation inside the nose. And also it's just good for nasal hygiene moving forward. Another mainstay of treatment is our topical nasal steroids. So a lot of people have heard of things like fluticasone or the brand name Flonase. This comes in a couple other types as well, like mometasone or budesonide sprays as well. And what this does is you spray it in the nose and it coats that lining to help control the inflammation locally inside of the nose and at the outflow of those sinus passages. And it doesn't quite get absorbed into the body like regular steroids do, so it's much safer to use, especially longer term, and very effective in relieving a lot of the symptoms of chronic sinusitis as well. Other considerations for treatment include oral steroids, like we just talked about, which are these tablets that you take into your body that are then absorbed throughout the body. And they work effectively and they work potent, they work strongly as well. But we typically don't like to use that repeatedly, as that can have more deleterious effects longer term on your body. But they are an important kind of workup and treatment plan for some patients with sinusitis that we do offer. And Next would be certain antibiotics, especially if someone has signs of infection and not just inflammation inside of the nose. So there are some types of antibiotics that we will sometimes use for up to 3 weeks at a time to try to help clear out the infections and get those sinuses working appropriately, aerating appropriately, and feeling better like we should. And last, we have other medications that we usually treat with comorbid allergies, so patients that are suffering with sinusitis but also have allergy symptoms. And some of those things might be like the topical antihistamine nasal sprays or even oral antihistamines, like Claritin is a common one that people have used before in order to try to help with some of those allergic type symptoms as well. And in a few instances, patients may continue to suffer from their symptoms despite attempts at prior medical treatment or even prior surgical treatment. And in these cases, we turn sometimes to these newer medications called biologics. These are medications that are dosed kind of weekly or monthly, and their goal is to kind of modulate the immune system and our response that our immune system has in its role in development of chronic sinusitis. And these medications, they're useful when needed, but they're typically more of a last line treatment as we see them right now with our research to try to help patients that have refractory disease despite attempts, like I said, at medical or surgical management. The goal of the combinations of medicines that we talked about is really to open up those sinuses, decrease the inflammation, allow for better aeration of the sinuses like they should, and drainage, and get us feeling better and improve our quality of life. Yeah, so surgery is necessary in some portion of patients in order to help control their disease as well. And especially for those that have been on medical therapy but are still not feeling great and still show signs of inflammation, or those that may have large polyps to begin with that, we might think medical management may not be able to decrease that disease burden effectively, then we do turn to surgery. A lot of times what we can do is plan for surgery on an outpatient basis. So you come into the hospital and you go home the same day. It's relatively minimally invasive. We do everything just through the nose with cameras and instruments, so there's no cuts on the face. We also use the CT that's been done previously to look inside the sinuses as image guidance during surgery. So we can actually tell where we're at while we're doing surgery to open up your sinuses that are affected. Surgery itself may last a few hours for patients, and they typically, like I said, can go home the same day. And a couple things that we will have patients do post-operatively. Number one is really rinse out their nose. That's very important. Using those saltwater rinses that we talked about prior to really help give moisture inside the nose, which the nose wants, and to also rinse out any mucus and stuff that's a normal part of the post-operative setting. In certain instances, some patients will have absorbable packing up in their nose that just dissolves on its own. In other cases, there may be some packing that needs to be removed at the first post-operative visit. But usually we'll see you back in the office about a week later or so, and that's whenever we do the first debridement inside the office. And what this means is we use the camera just like we did before when we looked in your nose in the office, and also some instruments like a suction to remove some of the mucus and crusting that may be present from surgery to help get it cleared out a little bit more effectively and help you feel a little bit better. The goals of endoscopic sinus surgery overall include removal of inflamed and obstructive tissue inside the sinuses. This allows to open up the natural drainage pathways of the sinuses much more widely so they can aerate and drain more effectively. And one thing I'd like to mention is that overall surgery is not curative. This is just that. Chronic sinusitis is a chronic condition. So what we do is open things up to, again, allow it to better aerate and drain, but also to allow for better delivery of topical medications following. That being our sinus rinses and topical steroids, which really are beneficial longer term to help keep that inflammation at bay so that we can have better quality of life and improve symptoms long term. Overall, sinus surgery is actually a very safe procedure. There are some risks that we'll talk about. Namely, these can be things like bleeding, infection, scarring inside of the nose or sinuses, and then much more unlikely things would be things like injury to the base of the skull or to the eye sockets or orbits which surround the sinuses, but that happens exceptionally rarely, less than 1% of the time. Overall, sinus surgery is very safe, and our goal is, again, to improve people's quality of life by performing this surgery for them. I do have a few important notes that I give patients for after surgery. We have a couple restrictions I like patients to follow. The first one being to try to sneeze through an open mouth. You want to avoid that pressure inside the nose. We try to avoid nose blowing during that post-operative period until you get the all clear from your doctor. And then Typically, you want to avoid any heavy lifting or straining, things that could provoke a nosebleed or pressure inside of the head. We want to avoid during that postoperative healing time as well. It is important that after surgery, you really continue to rinse out your nose. We say up to 10 times a day to be effective, because we really want to get that saline up inside the nose, rinse out some of that mucus and crusting, which is a normal part of our postoperative healing, but allow that to get out of the way so that we can have improved moisture inside the nose and improved healthy environment for better healing of the sinonasal cavity. Within about a week or so, we will see patients back into the office, and at that time we have our first post-operative visit where we'll see how things are going, answer any questions, and also talk in more detail about any certain findings of surgery or any findings on the pathology that we found in surgery as well. And we'll also do our first post-operative debridement, where we use a small camera like we did in the office prior to look in the nose. We'll look in there and we'll use certain instruments to remove some of that mucus and crusting inside of the nose as well. Again, to help create a healthier environment, get that stuff out of the way so that we can continue to heal. Yes, I think the biggest thing is don't suffer in silence. Chronic sinusitis, it's super common. It affects a lot of people, and it really can be a damper on your quality of life. It's not fun to not be able to smell, to breathe well through your nose. And with the proper medical plan, tailored treatment, and sometimes surgery, we can get patients feeling so much better and restore their quality of life and get them back to where they need to be.